Good afternoon, everybody. Welcome to today's webinar, Dementia Research in Core Communities. I would like to start by acknowledging the Wurundjeri peoples of Kulin nations as the traditional custodians of the land on which we meet, and pay my respects to their elders past and present. I would also like to extend that respects to all Aboriginals and Torres Strait Islanders people throughout Australia, given that our webinar participants might come from different places across Australia. The aim of today's webinar is to learn about inclusive dementia research and how to engage with core populations in dementia research. We will hear from two experts, Professor Bianca Brisnath from La Trobe University and Professor Lee Fei Lo from University of Sydney, presenting the topic Dementia Research in Core Populations. The presentations will be followed by a panel discussions with the contributions of two additional excellent panelists, Mrs. Agnieszka Jureka from the Partners in Culturally Appropriate Care Alliance, and Associate Professor Joe Antonias from La Trobe Universities. This webinar has been organized by the ADNeT EMCR Accelerator Group. Our aim is to support and advocate for early and mid-career Australian dementia researchers and how to develop future research leaders. Just to note that the webinar is being recorded today and will be made available to view on the ADNeT webpage. I am one of your chairs today. My name is Associate Professor Tuan Anh Nguyen from National Aging Research Institute and Swinburne University of Technologies. I am joined by my co-chairs, Dr. Emily Rosnick from Monash University, Dr. Edwin Tan from University of Sydney, and Dr. Stephanie Yong from Flinders Universities. I will now pass over to Emily to introduce today's first speaker.
Thanks, Tuan, and thanks everyone for attending our webinar today. So it's my great honour to introduce our first speaker today, Professor Bianca Brisnath. So Bianca is a Professor of Health Communication in Society at La Trobe University. Her background is in medical anthropology and public health, and her research focuses on cultural diversity, dementia, and mental health. She's conducted numerous studies on dementia prevention, awareness, diagnosis, and care, particularly within culturally diverse communities in Australia and beyond. She's authored over 150 publications and created more than 70 multilingual films, comics, and animations. She's also secured an impressive amount of research income, over 26 million. In recognition of her contributions, she was inducted into the State Government of Victoria's Multicultural Honour Roll in 2022. Bianca, thank you for joining us, and over to you.
Thank you, Emily. I just had to find the unmute button there for a second. It's a great pleasure to be here today, and I trust that everybody can see my full screen and there's no issues with it. But if there is, just chime in and I'll try and fix that. So like Tuan, I too would like to acknowledge the traditional owners of the land, and for me that's the Wurundjeri Woiwurrung people. On whose campuses, on whose lands the La Trobe campuses are located. The work that I'm bringing to you today really comes from a very long standing collaboration and engagement with multicultural communities in Australia and the Asia Pacific region. And I guess what I'm presenting to you today are some tips and tricks and things we've learned along the way. But there's, of course, much more to be done. And I do want to acknowledge that a lot of the work that we've presented or that we've developed over the years is not just been led by myself, but also by others, including people such as Joe and Tuan, as well as Lily Zhao and Li Fei. Now, ethnic diversity is really important in trials, in particular randomized controlled trials, because trials are in fact the gold standard for evidence-based healthcare. It's the basis on which we have new drugs and treatments, new models of care, clinical guidelines, and they're a very important mechanism for improving health equality and health justice, reducing disparities. I don't want to go through the litany of dementia disparities that exist in ethnically diverse populations. I think that's been well covered in the literature and in the evidence. So my goal today is, I guess, to inspire more people to work in this space and to work thoughtfully in this space. I guess I wanted to start with a recognition that ethnicity is actually very rarely reported in trials, and that's not just in the dementia field. It cuts across the board. We did a review of reviews where we looked at ethnicity across clinical trials over many years, and of about 237 trials that were there, we found that sex and gender is reported in 98% of them, but ethnicity in just about half. This is a problem that's not limited to the dementia field. You can see in orthopedics and stroke, very rarely will you actually get reports around ethnicity and/or race. This is a bit of a challenge, I believe, because it creates a kind of discrepancy between what we think we know and who actually lives with the condition. The two graphs on the left-hand side, the circles, that's some work that Li Fei and I did quite a few years ago now. In 2019, we published it. But at that point, we looked at existing clinical trials that were registered in the US under clinicaltrials.gov, as well as ones that were registered in Australia under the ANZ CTR. And you can see in both instances that there's very limited reporting around what about ethnicity, about how we actually classify people, and what that looks like. And often we get these really funny sort of selection criteria about excluding people who are fluent or not fluent in English or not proficient in English, which, by the way, the evidence very clearly shows that when you send a signal like that to communities, even if people within those communities are fluent in English, they interpret that that criteria as basically an exhortation that they are not wanted, that they are not required. So therefore, they will not take part. And that's really problematic because on the right-hand side is just some data I downloaded from AIHW, which looks at, who lives with dementia in Australia in the community and what are their countries of birth. And you can see that if we sort of contrast these two graphs, we've got some granular data there about, who's living with dementia in Australia in terms of ethnically diverse populations, but it's certainly not being mirrored in our evidence and the research that we're creating. And that is a problem we've got to address. So participants are not reflective of real world patients. Okay, so I guess that's the negative part of the presentation. Now, the positive part is, if you were wanting to work with multicultural populations, I guess the first question you might ask is, who should I work with? And my entreaty or advice would be, well, look at the epidemiological data to start with and consider what the question you are asking. So this is some epidemiological and demographic modeling that we produced, which mirrors dementia in multicultural populations across Australia from now until 2051. But there's a long lead time, and you may wish to consider what your topic is around and therefore what the prevalence estimates are looking like over time. So if you were looking at working with communities now and on care, then you might concentrate on communities such as the Greek community or the Italian community or Chinese communities. But if you're looking at where dementia prevalence is going to be in 20 years' time and you're thinking about prevention, then you might consider more emerging communities, such as from Sub-Saharan Africa or Oceania or from South Asia. So, it really is contingent on your question. But the data is then, so I would encourage you to look at that and not to make decisions on the basis of CALD versus non-CALD. That's a really I think, crude and clunky mechanism to operationalize and not actually very helpful in the long term. We wouldn't necessarily want to lump Afghanistanis and Brazilians in the same kind of category and say, well, they're all just different to Australians. I don't think that's telling us very much. You might also want to think about, well, what should I work on? It's all very nice to say who I should work with, but what should I work on? And if you're not yet aware of the National Dementia Action Plan, I'd certainly encourage everyone to have a look at it. I was involved a few years ago in creating the NHMRC National NNIDR CALD Dementia Research Action Plan. But I think that plan's now a few years old, and this is probably more relevant for us to think about because it is where the government's priorities are sitting from now until 2034. So it's well worth having a look at what those priorities are and where action ought to be taken, and designing research that is having that impact and meaning. Recruitment's always an interesting one. I get asked a lot of questions about recruitment, and recruitment is a challenge, I think, for any kind of study, but more so when it comes to working with ethnically diverse populations, and especially in a country like Australia, where our population isn't really all that large. However, there are a whole lot of techniques that you can use to engage different groups. I've listed those there. I won't go through each of them individually, except perhaps to underscore a very fundamental point, which is allocate resources for recruitment. You cannot ask community partners or bilingual workers or anybody else to assist you in identifying, selecting, and screening and recruiting people unless you're prepared to pay them. And so it's very important that funding is allocated for that, and that you are able to support those efforts. From the evidence, we know that referral and advertisement by a trusted source is crucial. Community groups, religious organizations, health and aged care services, ethno-specific providers, etc., are all really important, as are respected individuals such as doctors and other health providers too. They quite often you can get a good uptake with communities. Government agencies are also well regarded, but it's obviously much harder to push government to undertake recruitment for you. Very rarely will that ever happen. But that is a mechanism that's also well regarded in multicultural groups. Translated materials and interpreters are absolutely crucial. I don't think you can reasonably expect anybody who doesn't speak English very well to sit and complete complex documents, sign consent forms, etc. You need to have those resources available in language. Likewise, it's not just a matter of translating it from English to Italian or Greek or whatever it might be. It is about also culturally adapting and tailoring your message that it actually resonates with the communities and is something that they can reasonably undertake if you are asking them to undertake an intervention. Too much text can be overwhelming. This is a pitfall that researchers make all the time. And I think it's, we're all academics. We've had a lot of years of training. We've got lots of higher education. But for, many people in the community, academic jargon, technical language, lengthy forms is really very cumbersome and is likely to influence attrition and reluctance to even sign up to studies. So we need to think about more creative and clever ways of engaging with diverse groups beyond paper-based, formats. Other sources that you might consider could be things like graphics or videos or verbalization or designs. And the national statement, the ethics national statement, is continuously being refined and actually does leave a bit of wriggle room for all of these sorts of innovative methods. And I think there is a sentiment in not every single ethics committee in the country, of course, but in many quarters of making research more inclusive, more understandable, more digestible, and more user-friendly. And these are just some ways by which that can be done. A really important issue that I get asked about a lot also is how do we think about ethnicity when we are working with multicultural communities, whether they are a subset of a broader sample or whether we're just looking at those particular communities. How do we operationalize those variables? I would argue, and this is through a large piece of research that has been done involving a Delphi consensus and international stakeholder input, that there's probably 3 crucial variables that you ought to ask. One is about country of birth. One is about the participant's self-identified ethnicity and or race. And the third one is language. And there's a number of ways that you can operationalize language. 5 examples are provided there below, so you could ask them about their first language. that they spoke as a child, or the language they speak at home, or the main language that they actually speak, or how competent they feel that they are in the dominant language of the country they live in, or their preferred language, etc. So there's a variety of ways you can ask that question. But putting all three together is quite important. It helps to, I guess, illuminate the category of ethnicity a bit more fulsomely, because that is it's not necessarily a definition that can be kind of condensed down to just one variable. But at the same time, we've got to balance how many variables we ask about ethnicity in a study, where you might have many other questions you're also interested in having answered, without it becoming too burdensome for participants. But it's very important also when we ask questions about ethnicity and socio-demographic variables of our participants from multicultural communities that we are cognizant of the kind of underlying politics of those questions. We may not think that there's anything particularly controversial about asking someone their education or their religion. Religion, for example, can be quite important when it comes to dementia care. There's a lot of evidence to show that in ethnically diverse populations, it shapes coping mechanisms and positive attitudes to care. Likewise, education is very influential when it comes to dementia prevention. So these things are not necessarily controversial to us, but may be so to our participants. And therefore, we need to be able to, I guess, contextualize why we are asking these questions and frame them in ways that are going to actually elicit a response rather than turn off our participants. So we should be careful about how we ask these questions. Working with diverse participants in familiar locations is very important. Community-based settings tend to be most effective. And people often like face-to-face, particularly older people. Look, that's a legitimate concern because there has been a widespread move globally to target older people through scams and frauds and sort of intimidating text messages and things like that. And so older people are rightfully quite nervous about navigating the online world. Now, not all older people, of course, but a significant proportion are, and they're put off by the idea of doing questionnaires and things online. So it is about being able to go and be present if you can to obtain the data and the relationships that you need to. Invasive research, let's talk about that a little bit as well. We know in diverse communities certain topics that are very sensitive. Collecting certain kinds of samples are very difficult, and getting people to participate in trials, including drug trials, is not easy. If we look at some of the medications that have come up, the recent ones for Alzheimer's, all of those trials have been consistently had an underrepresentation of ethnically diverse populations in those original trials, and then sort of subsequent work then gets done to try and boost those numbers to understand if there is a difference in drug efficacy. But there are ways that we can overcome some of these topics. So here's some advice. I think with sensitive topics where you might have a kind of mental health issues or issues of depression, anxiety, we see these coming across a lot in carer studies. Extra attention to privacy and confidentiality is very important. One-on-one participation might be better. Recruiting through trusted sources, employing researchers from the same ethnic or cultural group, and treating these topics in a safe way is important. Likewise, with physical samples, if we can use discrete methods of sampling like self-testing kits, that would be terrific. Now, that works well for certain things. In the area of dementia, bloods might be a way to, using blood spots and plasma spots and home blood testing kits. We've still a long ways to go, but there's some really interesting work coming out of places like Norway and even in the US around these sort of blood spots. So that might be a really interesting way to boost getting some more physical samples. Things like PET scans and MRIs are harder cells to make. And so you might have to think more critically about, how we're going to collect that data, where is it going to be used, and making it very clear to participants how the data is going to be stored. With drug trials, most participants are actually quite enthusiastic to take part, especially if they're unwell at the time and their doctor recommends it. But it is really important to offer translation services so that participants are safe and can safely convey their symptoms, and there's not if they're experiencing anything that might be looking like ARIA or anything else, that they're able to talk about it with their treating doctor. I won't go through this very big long list, but except to just, I guess, reiterate that a lot of effort gets put into studies on recruitment, and then we sort of all fizzle out and forget about retention. And it's very underdone. And so then a lot of studies end up having these high levels of attrition. What we want to try and do is, if you've gone through the palaver of recruiting someone, build that relationship and try and keep them in the study so you've actually got some good numbers at the end as well that you can make some reasonable conclusions from. There's a variety of ways you can do that. I've listed some of that there. I guess the crux of the issue is really to making sure that you have that relationship with your participants so that they understand what it is you're trying to do, why it is you're doing it, and how often you're going to be asking stuff from them for. And also, by the way, giving back, that's really critical to communities. And I don't just mean financial remuneration. I also mean letting people know where the study's at, how it's tracking, what's next. People like to know what's happening to their data and where the work is going. Finally, I just wanted to, I'm getting close to the end. I just wanted to also emphasize that, we've done a lot of work around Australia. The consistent message that I often hear from multicultural communities is that they do want to be part of research. They do want to be part of trials. They see that medical research has a benefit to humanity. It's an opportunity to learn. It's an opportunity to socialize. And yes, you might get a little gift card at the end of it, but that's not the driving force of why people take part. And so we've really got to harness that enthusiasm a little bit more effectively and to kind of increase the diversity of the research participants we engage with. So in summary, I feel like I shouldn't really have to tell you this. You probably all well know. Governments and funders and publishers are pushing for greater study diversity in medical research, especially in trials. I'm sure many of you who have applied for Medical Research Future Fund grants will know that culturally and linguistically diverse populations are a priority population and often are featured quite strongly in the Dementia mission in particular. So it's well worth considering that. Excuse me, ethnically diverse populations do want to be part of medical research. I've given you some suggestions today for how you might think of recruitment, consent, data collection, and retention. And I think in a country like Australia, where 30% of the population are of a CALD background, it is incumbent on us to make sure that our research reflects the real world populations that we work with. So I'm going to end on that. And if you take nothing else away from my talk today, take that message away. That good science is inclusive science. Thanks very much.
Thank you so much, Bianca. That was a great presentation. Found it really informative and also very practical as well, with a lot of strategies to think about and put into place. So I would now like to introduce Edwin, who's going to introduce our second speaker. Thanks, Edwin.
Great, thanks, Emily. Apologies, my camera's not working, everyone, but it's my great honour to introduce our second speaker for today, Professor Li-Fei Lo. Li-Fei is Professor in Ageing and Health at the University of Sydney. She's a registered psychologist with a PhD in psychiatric epidemiology. Professor Lo conducts research that she hopes will make a difference in the world. Her knowledge expertise is in rehabilitation and post-diagnostic support for people with dementia, timely diagnosis of dementia, stigma and dementia literacy, community and aged care, and people from culturally and linguistically diverse backgrounds. Thank you, Li-Fei. The floor is yours.
Thanks, Edwin. I told Edwin that he should introduce me as his colleague Li-Fei Lo, who's Chinese but doesn't speak Chinese. So Tuan asked me to give you a case study, an example of how to do the things that Bianca spoke about in her project. So I'm going to talk a little bit about our Facing Dementia Together project, which is an NHMRC funded project that's been running for a year and a half now, and we're about to launch our public campaign. I'm going to show you no results from the study, I am only going to talk about methods. I would also like to acknowledge the traditional owners of the lands. I'm on the lands of the Gadigal people of the Eora Nation and would like to pay my respects to elders past, present, and emerging. So we have this project, and it's an extension of a project that we did in English and Chinese only in Western Sydney, where our aim was to co-design, deliver, and evaluate a campaign to increase help seeking for dementia diagnosis. But we also had a sub-aim to really try and improve our methods for CALD inclusion in dementia research and to tell people about what we found. For those of you not in Sydney, southwestern Sydney is a very large region, and the kind of tip near Bankstown, Campbelltown, Cameron, Liverpool is where we'll be working. The bottom end is much more rural and white, and showing here, I guess, the range of languages spoken in Sydney. Bianca already talked about using epidemiology to decide which communities you might work with, and we picked Chinese, Lebanese, and Arabic speakers because they're the highest populations in southwestern Sydney. I'd also really want to emphasize my team, showing you, I guess, our cultural diversity, because we have a bicultural team as well as a bilingual team. And obviously I need expertise in all the languages that we're working in, which aren't just Chinese, but Mandarin and Cantonese. We don't have anyone, for example, who speaks Shanghainese. And Aisha, our Arabic community worker, she speaks a few versions of Arabic. So we have Spanish speakers as well on the team and Vietnamese speakers that we haven't been using Spanish yet. I also wanted to, I guess, show you how multicultural our investigator team is. Both Bianca and Tuan are associate investigators on this project, and I really wanted to get a CI or an AI who from each community that we're working with in this study. So for those of you who don't do much CALD research, this really means that rather than having one full-time project manager or campaign manager, which is what we would have done, what we did in our English-speaking study, it means that you end up with more part-time staff, and you have to juggle then that staff member's availability to go to community events, for example. They only work a few days for you a week. And I guess juggle the need to upskill your staff often in dementia and in research because they have the community knowledge and the language skills. Tuan asked me to talk about how to start a collaboration and partnership. And at first I thought, well, that's easy. You write to the community partner and you ask them if they want to do your research. But I think if I step back from that and I think of when I was an early career researcher, it's harder because you need to build your personal brand so that when someone Googles Li Fei Lo, who's writing to them, they see that, firstly, I look Chinese, but also that I've been doing some work in the multicultural space and that any materials I've made look multicultural, at least. Even better if you can be on a committee or speak at a community event and your partners see you and meet you there, so that by the time you approach them around a specific project, that they already know you. For this study, we're partnering both with Cass, who I've worked with for, gosh, decades now, and a new partner, Multicultural Care, who we hadn't worked with before. So we really needed to invest time into the relationship. We've gone and met with Multicultural Care quite a few times before the grant went in and before the project started. We really had to understand that community and the organization as well, and where they were up to. Interestingly, CAS has done a lot of research and they understood what we wanted, but we really had to educate multicultural care and bring their staff along. And they were really, really great to work with. We just needed to invest that time, basically having coffee, meeting and chatting and getting to know them. Really understanding the values of those organizations, the problems that your project might help them solve and their goals. And like I said, we met with them at the grant design stage. So before the grant went in, we already talked to these organizations about what their role might be in the project and what the problems we saw in the community around dementia. We were really lucky in this project that Christine G approached us early on and said, I'm a professional translator. We would like to collaborate with you. So we've been really lucky to have an in-house translation team. And I'd like to acknowledge Sihan He, where we've really worked to improve our translation process so that it's culturally understandable. So we have a dementia expert check step and a community check step. And we do back translation of some key information, but we don't back translate all the materials. So you can see that we've been really lucky to have in-house translation in this study, and all our materials are in English. So we have materials in English, obviously, in simplified traditional Chinese, in Arabic and Vietnamese. To show you the scope of the work that we were doing in this project, I'm going to talk about our foundational work, so our qualitative work with CALD groups, interviews and focus groups. I'm going to talk about our co-design workshops and how we manage that when we were working with different CALD groups, and recruitment and processes for our CALD survey. We're going to launch the campaign next week, so I'm very excited, and you can watch our website Facing Dementia Together, which should go live. It's live in English, but the other languages will go live in the next few weeks. So for the interviews and focus groups, we spoke to 68 people across the 3 communities. And for the co-design workshops, we ran online workshops with key stakeholders, so people from community groups, but also older community members. We didn't have any people with dementia participate in the co-design workshops, but we did have carers of people with dementia and older people from those communities who didn't speak English very well. And we worked through all the co-design that we would do in English, but we had to step through it in simpler language and more slowly so that we could make this work. So the first thing we did is that we made sure that any older community members could use Zoom. We did a practice session with them, and some of our team actually went to people's houses and helped them practice setting up Zoom. We had to make sure we allowed much more time in the sessions so that we were not speaking too fast, for example, that our slides were clear because we ran them all in English. We also ran breakout groups in English, but what we found is that our community members actually spoke in their preferred language in those breakout groups and even in the main session. And one of the other participants would interpret for us if, well, they interpret for me because I was taking the Arabic group through these sessions. So it is really possible if everyone kind of is on the same page, and the community members were really, really enthusiastic and really wonderful and helpful, I think, in the co-design, really helped us make a better campaign. So it is possible to do it in English. You just have to be flexible about it. We also did a big survey with people from the different community groups. Here's Hazel collecting data in Vietnamese. Here's our team, so a big team, going out to do 50 Chinese surveys. And as Bianca said, a lot of our participants really preferred these face-to-face interactions, even for completing surveys. So I'll show you essentially how we collected the data. Most of the participants completed paper surveys. You'll see that paper surveys, 166 in Chinese, 124 in Vietnamese, and 78 in Arabic. Most of the surveys were completed in the person's native language, though a few were done in English, and the ones in English were mainly adult children rather than older people. And I put here that recruitment for formative research was mainly through aged care organizations. So we worked with CAS and Multicultural Care, who I said were partners in the research. And as Bianca said, you need to pay them, and we did give them money to help us recruit these participants. You can see we went to a number of community groups with a number of participants in those groups. We also worked with the Western City Margaret Resource Centre and the Vietnamese Friendly Senior Associations. To get participants to complete our survey, first you have to give them a free pen. We learnt that very quickly. And most of the groups offered lunch, gift cards, small gifts, and a lot of them asked us to give a talk as part of, giving back to the community. So we did the survey and then we gave a talk as well. We did give out flyers with QR codes, English on one side, language on the other side as well. We tried to recruit through Step Up for Dementia when you got 3 people. And some of the people we interviewed, we sent surveys to, and we got a few back through the post, but I don't think that was very successful. So this gives you an idea, I guess, of the grind of collecting surveys. In these groups, like the one that I showed you with Hazel's picture, we would sometimes read through each question, and a lot of times the person running the social group and the team would help the participants answer the questions as well, particularly if their literacy wasn't very good. Just showing you the difference in literacy of the 3 groups we surveyed. So much higher rates of university in Chinese. Vietnamese tended to have completed high school, and it was kind of about 1/3 of university, secondary school, and TAFE in the Arabic communities. Bianca alluded, I guess, to the idea already that we should be using the modes of communication that communities use. And we've been really interested for this project in whether we can use social media more effectively. Those of you who are recruiting older adults normally know that Facebook advertising is a pretty good way of getting older adults to participate in studies. And for our English language studies, we know that Facebook advertising works and how much we pay per click and stuff. We didn't do much promotion for the data collection in the first phase of the survey via social media. That you can see that we already have a WeChat page. But we're going to, in the next phase of our study, really be working on WeChat and the Little Red Book in Chinese, both Insta and Facebook in Arabic, and only Facebook for Vietnamese. And Bianca also said that people are really, really, really worried about scams. And so we have learnt that if we're working with someone from those communities, we can't just phone them up straight away. They often don't want to answer the phone. We have to text them first saying, it's in language, it's so-and-so from the University of Sydney. I'm going to ring you tomorrow. I'm going to ring you in 10 minutes as we arranged. And then you ring them to do the interview or to have the conversation, to set up the interview even. Okay. So I have no idea how I'm going for time. Hopefully I'm okay for time, but Edwin can just interview me. So here are some images from our campaign. Here are our checklists for dementia symptoms, which are available in all the languages we're working in. We've learnt that we need to print the information in English and in language, because the older adult may read and write their preferred language, or they might not even read their preferred language very well. But the second generation, particularly second generation Vietnamese and Arabic speakers, might speak okay, but not read or write very well. So we have to provide the information in English and in language so that the family can have the same conversation. very interestingly, part of what we've been doing for our project is promoting the National Dementia Helpline. We did ask the community, our CALD communities, whether they would be prepared to call the National Dementia Helpline if we taught them how to use TICS, the interpreter service. And people were really, really reluctant to do that. So part of what we're doing now is having the conversation with the helpline staff to see how they work with the interpreter service and how, I guess, mainstream organizations can support people who don't speak English well, or people who prefer to speak another language, because even though they have the interpreter service, it seems like it's a big barrier to ringing a helpline like this. And that's all I have to say. Like us and follow us on social media when we launch it very shortly. Thanks, Edwin.
Great. Thanks so much, Li Fei, for that great presentation. I'll now pass over to Stephanie to introduce our panel discussion.
All right, hi everyone. So thanks, Edwin. Well, now we'll move on to the second part of our webinar, and this is our panel discussion. So we invite our two speakers, Li Fei and Bianca, to turn their cameras on and join us. And I'm also going to introduce two additional panelists. We did have one more panelist, Mary Gogone, who was supposed to join us, but unfortunately she's had to do some urgent traveling, so she can't be here today. So first, I'd like to introduce Mrs. Agnieszka Trudeka. So Agnieszka is a member of the Partners in Culturally Appropriate Care SA team and also the Secretariat lead. So she's a passionate educator and also really advocates for CALD perspectives in co-design initiatives, discussions, policy making, system planning, and all the way through to implementation. Now, she's also currently completing her PhD through Flinders University. So here we are. And we're also joined by Associate Professor Joe Antoniades from La Trobe University. So Joe is a Associate Professor of Health Communication in Society. She's got an academic background that bridges public health, psychology, and primary care. And so a lot of her research focuses on cultural diversity, dementia, mental health, and community engagement. At the moment, she's leading projects funded by the MRFF and the Department of Health and Aged Care, really working alongside multicultural Australian communities, as well as other community-based stakeholders to really develop those community-driven dementia risk reduction education initiatives. So a couple of examples are the Mindcare program and the Mindcare for Women program. So I'd like to thank all our panelists for joining us here today. Maybe we'll start with the two panel members that that I introduced just then, if they want to give a quick summary about their perspectives and experience in dealing with dementia research in CALD communities. Agnieszka, do you want to go first?
Probably I should be the last one, but happy to start, because whatever I say will be counted as mine, and I won't have to make up if every point was taken. So thank you very much, both Bianca and Li Fei, for your presentations, because it resonated with me again and again, and because I'm still much more at the community level and sort of recruitment end of scale rather than very far into research, it resonated with me even more. So absolutely, I live and breathe the message repeated across both presentations about we need to have representative participant groups across ongoing research to have relevant evidence and to inform practice appropriately to our society. And on the recruitment end of scale, very often it is like please, please don't tell us that we need to speak English properly, because it is basically the communicate that finishes many potential conversations, and also it doesn't sound well. It doesn't sound welcoming, and the level of engagement is there and is increasing and is growing. So great potential to tap into, but yes, make sure that you make yourself known before you actually approached communities, particularly if it is first time you reach out to a given group. Try to find an ally, try to find a friend to walk you into it, because once you are in, you are going to be hugged and you are going to be welcomed and you are going to be invited to become a part of society family from now on into the future research, and the conversation is going to continue. So that partnering is really, really very important, and also sending that message. We are here to research, but we are interested in forming partnerships. We are interested, genuinely interested in hearing, in tapping into your lived experience. So we are not going to overwhelm you. We are not going to patronize you. We are not going to tell you what to do from now on into the future, but let's talk. Let's have conversations to actually exchange what you know, what we know, how we compare, and where are the gaps, how we can assist you with solving, with improving, with taking up new solutions into the future.
Great, thanks for that. And Joe, if you wanted to, yeah, do a quick.
So yeah, sure. So in terms of my experience with dementia research, first of all, Lifei, Bianca, I learned something new every time. I've worked with Bianca for more than 12 years. And fantastic presentations. And it's great to see you talk through your process as well, Lifei, of translation, back translation. And certainly in my work, everything you said is like, yep, tick, 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 tick. Drink the coffee, drink the tea. I worked with Agnieszka for a very long time as well. So having the community contact into the community, you really got to be a little bit of a multitasker. You got to be a salesperson. It's not a normal research job. Let's put it that way. You got to be able to pitch really well, but be genuine. You're not a used car salesman or lady. So it's a really important space. It's a space where I feel, having finished my PhD in 2017, having worked initially on the Bianca's Moving Pictures project, which was quite successful, I feel we've come quite a way in CALD research in Australia, where I'm seeing more and more people showing an interest in working with CALD communities, and it's becoming a little bit more organized. And I'm hoping we can move it forward in a more organized and sort of a, what's the word I'm looking for? Consistent manner. So we're measuring similar things, so we can actually do it in a sort of a way where we work in a systematic way to gain better benefits from the limited pot of money we have, so that we give back in a with the money we have, we can actually spend them better. I've spoken to Lifei, we've spoken about this, and I'm sure Bianca has spoken to Lifei as well about this. There's so many good resources that that's been developed, and I was just listening to Lifei, how to use TIS. I'm like, can we work together on how we can actually get people to do this? Because I got another project on aged care access. This is something that people will need to learn how to do properly. In fact, I don't really know how to do it myself. So it's kind of this black box, we just shuffle people in that direction, but I don't know how it actually works. It's kind of the black box. So another project. So yeah, so sorry, I digress. So yeah, so my experience has been very broad, but it's always with that root back to the community. What do they need? How can we best help them? And always talking to them in making sure that we're actually delivering things that are useful.
Fantastic. Yeah, great. Thanks for that. Yeah, so fascinating to hear about, all your different perspectives and experiences in this research area. So I think now we'll open up the floor to some questions from attendees. So if you can pop your questions in the Q&A function in the webinar, that'd be great. I think there's already been one question that Li-Fei's already answered. Wondering if Li-Fei, did you want to elaborate on that anymore? Or
I mean, someone else might have a stab at answering it. I'm interested in hearing what Bianca or Joe or Agnieszka think.
yeah, well, I'll read out the question from Mona then. And it's, how can researchers co-design health services or interventions that are appropriate for the culture and the language of CALD communities? Because it's been advised that culture and language are conceptually different, and would like some help on the methodological considerations to account for this. So culture versus language.
I can go if you like. Language is an entry into culture. It's not the same. So I think that's the really important thing to bear in mind, and that people can be part of particular cultural groups and yet not speak the dominant language that might be associated with that group. So, Li-Fei talked about the difference between first and second generation Vietnamese, for example, in terms of the capacity of the second generation to actually read and write in those languages versus English, and so on. So I think there's some critical differences there. South Asian communities are a really interesting example because most will actually prefer to read and write in English, but will want their information to be culturally adapted and delivered in their preferred language if it's an audio-visual representation, for example. So I guess those are some of the critical differences. And it's not about equating one with the other, because if you do, then you end up making this kind of false equivalence that if we just translate everything into whatever the language we require it to be, and then that'll solve all our problems. And if it were that easy, then we wouldn't be having seminars like this or be grappling with the disparities we are.
Great. I think Joe's got a hand up. You want to contribute to this one?
Yeah, so I would say also, I mean, language provides an access point into the services. And I think certainly when you have the access and you're in the service, it's also around having that cultural competency from the provider to actually dare to ask the questions, what the person actually wants, because otherwise you just become like a robot. So, you can't be expected to know everything. I'm not a clinician, but I've certainly seen and experienced and heard from many people, like you got to ask the person what they want. You can't expect just because they wear hijab that they want to be treated in a certain way. You got to ask the questions, what is it that, what's important to you? So I think it's a combination, it's a complex issue. So you can make the service as I suppose, culturally appropriate as possible, but there's also a danger that you then stereotype. I think that's something you got to be really careful and mindful of. I know that's making it really hard, but I think that's a real danger where you can culturally adapt and stereotype. So we live in a multicultural population where we have families that are mixed families and we can't just have an expectation that, just because you come from, as Bianca said, an Indian background, that you're necessarily, you look like Bianca, but you may actually have lived here for 3 generations, and you actually you just want fish fingers. You know what I mean? Like, I don't know.
Yeah, I agree. Yeah, thanks for that. And Agnieszka, I think you had something to add.
Absolutely. Thank you. Because again, beautiful, strong points and very, very valid. Probably what I would like to add slightly is we need to consider dynamics of the group. So tapping into cultural background, what does it mean to you? Unpacking languages, where those languages come from, and also asking additional questions about education level without really intimidating, like how good is your given language and can you really read and how well you can read. But understanding that dynamics through the level also of migration history, because again, we may have different cultural groups in different settings, in different locations, with different migration pattern, migration history in a given local setting. Also intergenerational. So for how long have you been in Australia, and what is really the strength of social capital? So how people are working together, contacting, engaging with each other within a community group, or how many people might be socially isolated and not tapping very efficiently into local services, into resources available online, etc. So unpacking that together through conversations again, and allowing that safe forum for discussion to allow people to look at each other around the table and really unpack together. And particularly if you engage interpreters, and I'm saying that because otherwise Mary would have talked about it, I'm sure. But if you engage professional interpreters, create the welcoming atmosphere and space, learning space to them as well, because we need to remember that obviously they bring that professional knowledge of interpreting, of translating, and knowledge of the language as such, but also the weight of code of conduct, which is great. But to a point, it may be a little bit limiting the flexibility. So we need to make sure everyone is on the same page, and sometimes it is not going to be useful during the work group to say antibiotics, where it would be useful to say the medicine that is going to regulate the temperature or inflammation in your body. So sometimes instead of giving the translation, it should be unpacking and allowing that space for further collaboration. And it is useful for interpreters to know, to have that space of agreeing the level of understanding and comprehension, and also vocabulary needed for our conversations.
Great, thanks. So what I'm hearing is, we need to definitely allow a lot more extra time and really welcoming any feedback people might have, and ask specific questions about what should be included and addressed. Okay, so I'm just looking at the Q&A box to see if there's any others. But while we wait for people to type in some more questions, I might hand over to Tuan. I think you had a specific question for Bianca, was it?
Yeah, thank you, Stephanie. Actually, my question is directed directly to both Bianca and Li Fei, and other panelists might also comment on. Before able to do dementia research in coal communities, we have to win the grant, right? So could you please share with us your experience in forming the team, partnering with the stakeholders to win grants in coal communities? Perhaps start with Bianca first, then Li Fei and Joe and Agnieszka can comment on.
So almost every grant I now write, I'm talking about category 1 big major grants through MRFF or NHMRC, they include a consumer from the CALD community, but not just any old consumer from the CALD community, but actually a consumer from the communities that are the subject of the investigation. So that's the first thing, right? So that's really important. And I include them not as an AI, but always as a CI in my grants. And that's kind of like, when you're constructing a grant, you're being very tactical about how you organize your team. I almost think your consumer is a bit like your biostatistician or your health economist. It's a not negotiable anymore. You have to have them. So that's kind of the level, I guess, the role I give them to start with. We always have a consumer advisory panel that we try and create. And we increasingly, what we do is with existing grants, we leverage that panel to engage with them about future grants. So you're building on the work, you're not just sort of starting from scratch every time. But, I do appreciate that if you are new to the field or an early career researcher, you might well have to start from scratch, but it is not impossible to do. As Li Fei mentioned, CALD communities are very enthusiastic about getting talks given to them. And so that's a great opportunity to actually, offer up your services, go down on a Saturday afternoon, give them a bit of a talk about, what dementia is or what memory might look like or whatever your area of interest might be, and then pitch your idea at the end in a simple language and say, what do you think? So that's the kind of engagement, because grants ask you for that. What's your engagement with communities? How do you actually know this is a need? What do they reckon? And so you could do some of that too in advance. So I think having an advisory group, having a CALD consumer, engaging with the communities beforehand so that your work actually resonates and has meaning with the groups is really critical. I'll probably stop there. Li Fei, you might have more to add.
I mean, what Bianca said, but you really need to have made sure that you've covered off on your translation. Like, I assume that you're talking about CALD grant one, or a grant with some CALD component in it. You need to have covered off on your translation or interpreting, however you're going to do that, whether you're ideally with some bilingual staff, and then if you can have a professional translator or interpreter on your team as well, your CI team, then it shows that you really know how to do this properly, I think. Because there's not that many academics, translation and interpreting academics, so you might not be lucky enough to get one. And then your community partnerships are really, really important. We haven't always been able to name people from those community organizations as CIs. Sometimes it doesn't make sense. We name them as AIs, and we get a letter of partnership, which we often draft and negotiate with them. And remember, lots of cups of tea, and you take food to meetings because this is acceptable to bring food to meetings. And I have baked food from, in my own kitchen and gone to a meeting because it's important to show that you're bringing it, from you, not the university's buying food. And we're not saying that you should bake food for all things, but I think it's really appreciated if you really share something from your culture or that's meaningful in terms of building the relationship.
Can I add something to that?
Yes,
yeah, I must agree with you, Li Fei. I mean, I wouldn't say I baked many cakes, but when I did bake a cake, it was much appreciated by the Indian community. I've never seen a Danish cake being sucked up like that before. It was gone in 5 seconds. It was really appreciated. But the other thing for my MRFF grant, I did quite a bit of consulting previously with communities, including, and I also spoke to Agnieszka, whether or not my grant would actually work and if it was a good idea, you know, other than just speaking to the consumer who happened to be the CI on the grant. And I put the consumer as high up as that they could possibly come on the grant, like as number 2. I couldn't do, it was quite an ordeal putting an older person in the grant because Sapphire is not set up for this. But yeah, so while you often scramble a little bit time-wise, you know, it's always nice to see if you can actually get some feedback on the grant from different community organizations and ask, you know, do you think this will actually work in real life?
And I have something else to add. After your grant submission was successful and your research gave you the answers that amaze you, not only the others, and you have your publications ready and sent for printing, please do stay in touch with communities. We would love to hear from you. We would love to have fridge magnets or newsletters or side to side, as was said before, like English and preferred language on next to each other or on both sides of a page, but also come back more with more talks. Let us hear what we helped you to discover, what is meaningful to you and to academia, but what is going to be useful and so what to us on the community level, what will help us to enjoy that we contributed, but also will change our lives into the future. So publications, yes, dissemination at the conferences, yes, but also back into the communities, like look what we've done together, what we've achieved together. And then it is going to open one more door into the future, into the continued research into the future for more answers.
Thanks for that suggestion. What we haven't done recently, but we found worked well in previous projects, is when you're at the end of the project, you actually work with your partner organization to do some media in like Chinese newspapers is what we did, because it's really good for the community. Like that's a good way of disseminating, because often people don't want to give us their name and address to, you know, send like a 1-page summary. So the way that we've managed to do it is to like do a media release with the local Chinese newspaper or something, and then you can then share the results of the findings, and your partner organization gets, you know, some nice press as well with the professors shaking hands or, you know, whatever, sitting in the facility. And I think that's a really nice way of kind of giving back to the community, particularly because they don't want to give us their name and address. So we can't, for most people, we can't write them a letter with the findings of the study. So like that type of local media is a nice way to do it.
Thanks, Li-Fei. Jill?
But also I think because, I mean, for example, with your work, Bianca's and my work, often we have resources. So we don't want it to just die. Like, it's kind of pointless. You run a project for 3 years, you work really hard. I think for us, it's certainly for myself, I do it, yes, I do it for the research, and I do it because it's, you know, the research is important, but I do it because I want to create resources that the community can ultimately use. So it's kind of pointless if nobody knows about it. So, you know, Bianca and I, we have a website that we've kept alive for a long time. We keep updating it, but if nobody knows about it, it's you know, like it's pointless to have it. So I think that's an important way of, you know, keeping on spreading the good word, keeping on disseminating, raising the brand, raising the publicity, working together across, you know, providers, advocacy groups, across, you know, our academic friends, and different, you know, this kind of, you know, all the people listening here, you know, as far and wide as we can get the information, because also then we stop doubling up on things that's already been done. We can work together on other things that might be valuable and in other languages, and you know, yeah.
Yeah, thank you very much, Joe. So what I hear here is that we need to engage with the consumers from the conception to all the way through to the disseminations of the findings, and even after that, right, when we have created the resource and we share with them and we implement it in the communities. One thing I really would, yeah, Lifa, you want to say, comment?
I mean, my standard how to get a big MRFF or NHMRC grant is that you actually need to be planning that project 6 months or a year before you think you're going to put the bid in. So we are writing for MRFF, that, you know, the MRFF call that's open now, and we started the work last year. We started having meetings, we started thinking about it, we started talking to people, talking to consumers, getting my consumer CIs on board, like all those things we did before the call came out. Because you know that when the call comes out, yes, you'll need to tweak, but you've already got those relationships in hand and you have some kind of plan. And it's not like, oh, there's a call now I want to think about it. Like, you kind of believe in the project enough that you're going to, you know, try and figure out how to get either a small pot of money or a bigger pot of money to do it.
Thank you, Lifa. Stephanie, over to you.
Yeah, so I've just got some comments in the chat. So another suggestion is just simple thank you cards. Lots of participants often appreciate that, and it's a good thing to use in communities. I've known other research groups to even just send a regular Christmas card to all their research participants, thanking them for their efforts, and also just keeping them in the loop, giving feedback. So really just continuing that line of communication and keeping people updated. Okay, so we'll move on to another question. So Zara asks, what do you recommend for ECRs who don't have guaranteed funding or support to continue projects? So what are some ways we can manage the relationships that we've built until we have that further funding for this work?
So I'll start us off. Again, a relationship with any kind of community partner, irrespective of whether they're an ethnically diverse group or not, should not be entirely transactional or purely transactional. Of course, transaction is part of it, but it should not be all of it. And too often in research, we are trained to think like that. I want something from this community. I've got what I need. I'm off. See you later. Goodbye. I'll publish my paper, present my conference presentation, and, you know, whoop-de-doo, write my next grant. It's all good for me. Now, we know in the funding landscape, it doesn't work like that. And all the more reason to actually maintain those relationships, because opportunities are consistently now coming along through funding. Like the MRFF has been a game changer for many of us, right? Many of our careers would not be where they are today if we didn't have that $1 billion kind of tranche of funding being dispersed every year. So when you've got something that transformative in the landscape, there will always be opportunity at some stage or another, right? So the question is, how do you capitalize on that opportunity when it comes? And if you don't have any relationships, or if you've taken a purely transactional approach to it, where you've extracted and left, then it's hard to reseed and reanimate those relationships. But if you've kind of kept it buttering along, then it's quite easy to actually mobilize and to do. Now, what does maintaining a relationship mean, right? In these sort of things? First of all, these are professional relationships, right? They're not personal ones. So, you know, I appreciate that Life and Joe are baking cakes and things like that. It's wonderful. I can't bake. I just can't, right? I'd probably kill everybody with my baking. So I don't bake, right? But I'll take other things along and other assets and resources and information and all of that sort of stuff. And, you know, I will, you know, when communities invite me to come and give a talk, I will go and give that talk. Sometimes I'll have to do it on a weekend, and sometimes I'll have to drive out an hour and a half from where I live, and then an hour and a half back, and I'll give a talk to, you know, 20 people in a community, 15 of whom might look like they're fast asleep, right? And maybe I'll get a cold cup of tea at the end of it, and then be shuffled out the door sort of thing. Or I might get a very animated, engaged audience. We did this once with 300 people and they were really excited, but they really, about 15 minutes and they didn't want to really listen to me. They wanted to listen to the Sri Lankan comedian who came after me. So, that's life too. So you have to do those sorts of things and kind of, stamp up and reciprocate. That's really crucial. And I think approach your partnerships, the professional relationships, but not purely transactional in that sense, in that you're extracting, you must also give back, so that when your opportunities come, you can pick up the phone and ring them, and they will support you.
Let me add that we write letters of support to their mini grant references. We provide advice around evaluation. Besides giving the talks, sometimes you have to go to a community event and just be there and have your photo taken because the minister is there and they want to show their partnership. And sometimes I go and sometimes I send a team member, which is sufficient if you have someone from the university. So, and I think the other thing which is also important in terms of maintaining the relationship is if you see something relevant to them, like a paper, if you send it to the partner and say, I thought of you, this paper seems relevant to your work, they really appreciate it. And it's not like you need to make contact like, every 6 months even, right? Like if you do that once a year or when it's natural, then that relationship is maintained just because you're like their friendly university person who they need to talk to when they have a dementia or aging or something. It doesn't have to be very regular contact.
Yeah, I agree with that. I mean, if you've established like a friendly relationship with them and they've been happy with the interaction they've had with you. One example is I had a Greek group in Sydney that I hadn't reached out to for, I think, 3 years. Literally, it wasn't because I didn't want to work with them or it wasn't one of my regulars. And I reached out to her, hey, Lily, can I, whoever, and she got back to me. It's like, yeah, I can help you. No problem. I remember. Yeah. Perfect. No problem. So I think, if they genuinely feel that you really want to work with their communities, because they don't have time to sit and write Christmas cards to you either. They work with lots of people. So, I have the people that I work with on a regular basis all the time. And those people I keep contact with very regularly. And then there's the people that I will reach out to when I need to. But I always have very good friendly relationship with them, and they know that I'm in it long term. And I don't just take them for a ride. And we have website, and I will share resources with them, and if they reach out to me, I will help them with stuff, like, yes, we have resources for you. Or, if they need something, I'll try and do my best to help them if I can. So, it's not just a one-way thing.
Edwin and Emily, do you have questions?
I do, if that's okay. So Bianca, you actually mentioned just in passing the Sri Lankan comedian. But my question kind of related to that because I was curious actually about the use of humor in any potential, recruitment materials, retention strategies. So we had a visiting PhD student from Amsterdam with us last year, and she ran some focus groups with our participants, and humor was actually consistently coming up as something that they would like to see more of in our materials. So could you speak to us about whether you actually have any experiences or insights on the use of humour in those materials in culturally and linguistically diverse communities?
Yeah, it's a great question. Humor is very culturally bound, right? So jokes in English very rarely translate well into other languages and vice versa. But at the same time, I think it's, if not humor, tone is really, I think, what participants are getting at. That a document or a resource or something can be lighthearted, evocative, emotional, moving. It can be all of those things, but it need not be those really dry and awful participant information and consent forms that our ethics committees impose upon us constantly, which kind of just, so slightly soul destroying. I think there is a big piece of work to be done about socializing ethics committees about what an appropriate and culturally approachable document looks like for the communities we work with, and I think even broader than that. So that's an important piece that still needs to be done. The other thing I wanted to say about humor is you are never less of a professor or any of those fancy accolades than when you go into a community. I cannot tell you how many times I've had my cheeks pinched in community. It's really quite embarrassing, but it happens a lot. And I would never go in any other professional setting and allow someone to pinch my cheeks, but in community settings, somehow and cheeks on my face, let me clarify that. And it's really very, and it's always and lots of hugging and lots of sort of, oh, it's so great to see you, and that sort of thing. So that's kind of part and parcel of the social interaction. That it is a different setting. It is a little bit more lighthearted. It is a bit more, you need to be more kind of adaptive to what people are wanting. And I think if you kind of go on with that mental of, I am the expert, it won't work so well. And like I'll just end on another funny note. I once gave a talk to a community group. I won't say which community it was, but many older people came up to me at the end and wanted to marry me off, which was quite funny. Fortunately, I was already married, so that sort of nipped that in the bud. But those are all sorts of things that do tend to happen when you engage.
Absolutely. Thank you so much for sharing. It's definitely something that has been echoed by our participants as well. Jo, you had your hand up for that as well?
Yeah, I have a small dream about when I'm done with all my other research to actually work with humor. I would just love to do, and Bianca knows this, and she's like, oh, Jo, this is I even have the title for it, Dementia, It's No Joke. And it'll be great to get stand-up comedians involved from different ethnic groups. I was thinking Sushi Mango would be. But yeah, I think it would be just because humor, I don't know about you, but I remember what comedians say personally. I don't remember what's in a public health document. I think it would just be a fantastic public health campaign.
Can I add two things? Just on the ethics, how I should have said that how we're managing kind of the massive consent form is we have the massive consent form that ethics requires, and we translate it. And then we have a simple information sheet that ethics also approves that is like much more user-friendly, but doesn't say all the stuff that we also give out. And then if we're going to a community, we have it on screen, even simpler, like these are the things. You don't have to do this. You could still get the free pen. It takes you this long. You don't have to give us your name. If you complete the survey, you consent. You don't have to give us your name. Remember how you don't have to give us your name. And that's how, but pragmatically, we have to find ways of solving it. On the humor, I mean, our team have been thinking about communications and humor. And I think, like Bianca said, humor is very powerful. And I often poke fun at myself in the talk. That's allowed. Like I say, we all hate exercising, no one more than me, et cetera, et cetera. I think that it really depends on who in the community is making the humor. You have to be very, very careful. If from within the community you make the joke about your community, that is acceptable. But if outside, so I can make a joke as a migrant Chinese person who doesn't speak Chinese very well. That's completely acceptable to other people in my demographic. But I cannot poke fun at like older Chinese people. Totally no. But maybe I can complain about my mother a little bit like that and her, how she treats me. That might be okay, but not her, right? But our relationship. So I think you have to be really, really careful in using those cultural stereotypes which you use in humor, which are grabby and powerful, especially if you want to use them like not in a public talk where you have a longer engagement, but if you're trying to use them in an ad or in recruitment on social media, like how you do it. I've had conversations with both Bianca and Jo about our social media, and we're trying to really make social media that feels very authentic. Like our team made it and it's not that professional and we just filmed it on our phones, but it's us real people talking to other people in the community rather than like all fancy like the university makes with like nice transitions, because we really want to like the tone of it to come from like other people in the community, you know, from us, but we're part of like the Sydney Southwestern community. So I think you really thinking about that in your advertisements as well, like especially if they look a bit AI generated, very bad.
So get off the AI generated Canva templates.
Template is fine, but the images, like I think Gang here, like you made it yourself, and here you are like just talking to community, like that feels more authentic, I think, than like shiny, you know, shiny people. Shiny people no good.
Thanks, Li-Fei. Bianca?
Just to add that humor is risky in the work we do. There's no question of that. So it's a very boring thing to hose down all the enthusiasm, but humor is very risky. And especially with social media communication. Now, I never knew this phrase. I learned it yesterday. Shows how out of date I am. Brain rot. But there is brain rot social media content that is deliberately created to rot your brain. But it has, you get these thousands of likes and people will share it and all the rest of it. Now, the risk comes in for, I think, research teams when you are affiliated with the university. If you start suddenly generating a whole lot of brain rot, which might get you heaps of likes and actually get the message you want to get across and out there, but then you can imagine the university is going to go, well, hang on a minute, you know, we didn't sanction all that brain rot. That's the antithesis of what we want to do. So it kind of, there is this tension between kind of sitting in an institution and I guess the almost the freewheeling humor of social media. So there is that risk that needs to be considered as well.
Definitely agree. Thank you very much. Do we have any other final thoughts, I suppose, before we close off today? We've got 3 minutes left.
Agnieszka raised her hand.
Yes.
Briefly, because it was already flagged by Bianca, we need to really consider how do we communicate, in writing or in person. If we interact face to face, we may check with the audience if our humor works, if it was understood, and if it was interpreted the way we meant it. And also probably a word of caution, again, repeating what Bianca said, in our research situation, we need to position ourselves at the professional end. So it is our job to do the homework, to get ready, to have our reference information useful, to check it, to verify in live situation or through the text, maybe asking someone to have a look. If it is appropriate, if it is well targeted, curated appropriately. But also I remember the situation like when I approached the friend and mine community, and it was ages ago. And I remember my reaction when the very important people from the community were greeting me into the meeting. And it was a group of men, and all of them were starting the handshake with offering their hands. As Polish as I am, I was brought up with the rule that it is up to me to offer my hand. But because I was at that professional end in that situation, it was up to me to manage appropriately. We differ in our social norms, so it is up to me to adjust.
Thank you, Agnieszka. I'm afraid that is all the time we have for question now. And thank you to everyone for attending today's. A special thanks to our speakers and panelists for a great discussions. A recording of these webinars will be available on the ADNeT website in the next few weeks. So don't forget to subscribe to our EMCR newsletter for updates on our group's initiatives. We send out e-newsletter every 2 months. You can sign up to receive the list at the website listed here. And finally, please be sure to follow us on LinkedIn, where we will also post regular updates. And thanks again for joining us today. Bye for now.
Bye, everyone.
Thank you. Bye.